Hello everyone, I am Nivedita Jena from Ambika Prasad Research Foundation. Welcome to all of you to our channel Biodiversity and Conservation. Today we are going to discuss about the blood disorders. What type of disorders are there and their types and their symptoms. So let's start. What is blood disorder? Blood disorders are conditions that impact the blood's ability to function correctly, and there is a range of different types and symptoms depend on the type. However, some common symptoms include unexplained fatigue and weight loss. Most blood disorders decrease the number of cells, proteins, platelets, or nutrients in the blood or interfere with their function. A majority of blood disorders are caused by mutations in parts of specific genes and can be passed down in families. And so, medical conditions, medications, and lifestyle factors can also cause blood disorders to develop. Here are the symptoms of this disorder. Symptoms depend on what part of the blood or organs is affected, as well as the severity and extent of the condition. And however, the majority of people with significant blood disorders tend to experience a general feeling of being unwell for no apparent reason. And the signs of white blood cell disorders include frequent infections, wounds that do not heal or are slow to heal, unexplained exhaustion, unexplained weight loss. And the signs of red blood cell disorders include unexplained exhaustion, shortness of breath, dizziness or lightheadedness, rapid heartbeat, muscle weakness, difficulty concentrating and remembering, and the paleness. And the signs of platelet and clotting disorders include difficulty forming blood clots at wounds or controlling bleeding, injuries that are slow to heal or keep reopening, unexplainable bruising or skin that easily bruises, unexplainable bleeding from the nose, gums, gastrointestinal system, or urogenital system, etc. Then here are the types of blood disorders. Many blood disorders take their name from the component of the blood they impact. Mm, So the following categories describe blood disorders that cause a decrease in blood components or affect their function. If the disorder involves red blood cells, it indicates anemia. If the disorder affects white blood cells, uh, then it's for instance leukopenia. And if the disorder concerns platelets, is of the thrombocytopenia. And categories of blood disorders that increase blood components are erythrocytosis if the disorder involves red blood cells, leukocytosis if the disorder affects white blood cells, and thrombocythemia or thrombocytosis the disorder concerns platelets. So let's discuss briefly about the red blood cell disorders, white blood cell disorders, and platelet cells disorders. Um, the first one is white blood cell disorders. In this type, white blood cells help the body to fight infection. They begin life in the bone marrow and develop into different types of cells, each having a different immune purpose. The major types are neutrophils, which destroy bacteria and viruses. Then the lymphocytes, which kill viruses and regulate the immune system. Monocytes or macrophages which eat dead or deactivated bacteria, viruses and fungus, and the basophils and eosinophils which help the body respond to allergic reactions and help destroy parasites. Some white blood cell disorders impact all the different types of white blood cells in the blood, while other disorders only involve one or two specific types. Of the five types of white blood cells, neutrophils and lymphocytes get impacted the most. And most white blood cell disorders are either a type of cancer or proliferative disorders. And proliferative disorders involve a rapid increase in the number of white blood cells that are circulating in the blood. This mostly occurs because of an infection, although occasionally bone marrow cancers may be responsible. Leukopenia, however, is due to a reduction in the amount of circulating white blood cells, and this usually occurs because of illness, infection, toxin exposure, certain medications such as corticosteroids or chemotherapy medications, and genetic mutations. And there are three major types of blood cancer that impact white blood cells, and they include this following: the lymphoma or leukemias and myelomas. So the lymphoma is a type of cancer that occurs when lymphocytes change and multiply rapidly. There are two major types of lymphoma. One is Hodgkin's and non-Hodgkin's lymphoma. According to the American Cancer Society, non-Hodgkin lymphoma is one of the more common types of cancer in the US, accounting for 4% of all cancers. And Hodgkin's lymphoma is far rarer than non-Hodgkin's lymphoma. Again, according to the American Cancer Society, around 8,500 people in the US had the condition in 2018. Of those people diagnosed with Hodgkin's lymphoma, and 86% will live at least 5 years. And the leukemias involve the buildup of abnormal white blood cells in the bone marrow, which interferes with its ability to produce red blood cells and platelets. And leukemias can be acute and develop quickly, or chronic and develop more gradually over time. Um, and the myelomas involve the buildup of plasma cells in the bone marrow, which interferes with the development and function of other blood cells. The most common type of myeloma is multiple myeloma, where abnormal plasma cells build up or form a tumor in numerous locations in the bone or marrow. Um, and The treatment and diagnosis: a doctor usually diagnoses leukemias, lymphomas, and myelomas using um, so the treatment and diagnosis usually for leukemias, lymphomas, and myelomas, including medical exam and a complete medical history, blood test, urine test, bone marrow aspiration and biopsy, lumbar puncture, which is a spinal tap or where doctors collect spinal fluid for examination, and imaging tests such as X-ray, CT scan or PET scans, MRI and ultrasounds, etc. So, the blood cell cancers that do not yet cause symptoms may not require treatment aside from monitoring, and doctors usually treat people with aggressive or active blood cancers using some mix of chemotherapy, radiation therapy, surgery, targeted drug therapy, which are medications that help increase the effectiveness of chemotherapy drugs or destroy elements of the cancer cells that chemotherapy drugs do not. And stem cell transplants, which involve infusions containing bone marrow cells that are capable of forming blood cells to replenish destroyed cells. So coming to the red blood cell disorders and its types, anemias where there are not enough red blood cells or the cells do not work correctly are among the most common blood disorders, and according to the American Society of Hematology, anemia affects more than 3 million Americans. So the most common types are iron deficiency anemias, when the body does not have enough iron or cannot properly absorb it, and then the pregnancy anemia, when there is more of a demand for red blood cells than normal. Then vitamin deficiency anemias, usually caused by low dietary intake of vitamin B12 and folate. And then the non-inherited hemolytic anemias, where red blood cells are broken and destroyed in the bloodstream abnormally, either by injury, illness, or medications. Then the inherited hemolytic anemias, where red blood cells are broken down or destroyed more quickly than the body can replace them. And the last one is the aplastic anemias, when the bone marrow stops producing enough blood cells. If the cause of anemia is not apparent, such as injury or infection, or to assess anemia, so a doctor will do a physical exam, review individual and family medical history, carry out blood tests such as complete blood counts, reticulocyte count, and peripheral blood smear, and do bone marrow aspiration and biopsy for the diagnosis. And the treatment depends on the cause but commonly includes blood transfusions, dietary changes, surgery, medications that stimulate the production of bone marrow and new red blood cells. Then coming to the platelet cell disorders, common platelet disorders include hemophilia and von Willebrand disease. Hemophilia is a genetic condition caused by a lack of or defective clotting factors in a person's blood. People with hemophilia bleed longer or more excessively, both externally and internally, than people without the condition. And this is often passed down from parents to their children, but the National Hemophilia Foundation estimate that approximately one-third of cases develop spontaneously, and hemophilia is one of the better-known blood conditions, but it is still quite rare, developing in an estimated 1 in 5,000 live births. And then the von Willebrand disease occurs when the body lacks the von Willebrand factor, a substance that allows platelets to stick together and form clots. Most cases of von Willebrand are relatively mild, and people may only require treatment if they are injured or undergo surgery. And while many platelet disorders involve a reduction in the number of platelets present in the blood or their function, several conditions can cause an excess of platelets. And the treatment and diagnosis here. To diagnose and assess platelet conditions, most doctors will carry out a physical exam, a review of individual and family medical history, blood test. Treating blood clotting disorders typically involves replacement therapy, where the doctor gives the person infusions containing the specific clotting factors they are lacking, and additional therapies include desmopressin, a synthetic hormone that promotes the release of von Willebrand factor and factor VIII, and antifibrinolytic medications that help prevent blood clots from breaking down, and birth control medications to reduce heavy menstrual cycles. Additional treatment options include blood transfusions, corticosteroids to slow platelet destruction, immunoglobulins to block the immune system, and the surgery to remove the spleen in severe cases.